Welcome to this new video, guys. We're going to be speaking about secondary osteoporosis. So guys, we have a really nice mnemonic over here. It's called I sat on a ham. And the reason I chose this is because as we know in osteoporosis, we have many types of fractures. So that may be vertebral fractures, but more importantly, humerus, femur fractures, or femoral neck fractures, or the distal radial fracture. So that can be a Colles fracture. So of course, maybe a femur fracture, femur neck fracture might have occurred when the patient was trying to sit down, some sort of load or activity, might have wanted to sat down. So that's where the mnemonic kind of comes from, I sat on a ham. And this covers all the risk factors for secondary osteoporosis. As we know, the primary osteoporosis can be divided into type 1, type 2. Type 1 is post-menopausal, type 2 is senile. So post-menopausal because we don't have estrogen, and senile because they are maybe quite elderly, and that's why we have osteoporosis. But these are secondary osteoporosis, so there is some sort of underlying cause. So the mnemonic I is going to be immobilization. So immobilization can possibly even cause osteoporosis, and immobilization doesn't really make sense, but when you kind of look at the treatment of osteoporosis, it's basically doing weight-bearing exercises. So that kind of makes sense, that now you're doing weight-bearing exercises to prevent osteoporosis. Not the treatment but the prophylaxis, immobilization can possibly lead, but more importantly we can come into the first one here, steroids. So steroids can be glucocorticoids. So if someone has increased utilization of steroids, it means increased reabsorption of the bone, and that leads to decreased amount of decreased amount of formation of the bone. So that can lead to osteoporosis. The next thing here is going to be A is going to be alcohol. Alcohol over here can be a cause because alcohol can lead to increased renal secretion of calcium. It can lead to increased renal secretion of calcium, and this can lead and basically decrease uptake of the stomach, intestinal, pancreatic uptake. So this, by the way, over here, guys, all credits, I should mention credits, they go to Amboss. I've taken most of this information, if not all, from Amboss. Mnemonic is mine, however the information is taken from Amboss, so credit goes to Amboss. They want to copyright or anything like that, credit goes to them. Next thing is going to be here, aromatase inhibitors. Not too sure the mechanism behind this, but I kind of think about it like, maybe the aromatase inhibitors, maybe we're not activating some sex hormones, and that may not lead to that would lead to increased amount of reabsorption, less formation. The next thing over here is going to be anticoagulants. So anticoagulants can also be here. And then the next thing, OT, is going to be here for thyroxine. H is going to be over here for the hypogonadism, hypercortisolism, hypothyroidism, hypoparathyroidism. Hypothyroidism, parathyroidism kind of makes sense because there's increased metabolism in the body. Hyperthyroidism means because we're going to have increased amount of calcium. Increased amount of calcium, kind of bone reabsorption. So that does make sense that if we're reabsorbing the bone, we're going to be getting osteoporosis. Other one, A is going to be anticonvulsants, and then M is going to be a multiple myeloma or maybe some sort of malnutrition. I forgot to write it over here. Malnutrition. So guys, honestly, if you guys want to learn this mnemonic, just learn it as sat ham. So just learning as sat ham, I think that's going to be much better. So steroids, alcohol, anticonvulsants, anticoagulants, and then thyroxine. Then we can have, of course, the ham, which is going to be the hypogonadism, the hypercortisolism, hypothyroidism, hyperparathyroidism, and then we're going to have anticonvulsants, multiple myeloma, and the malnutrition, for example, is going to be here. So I sat on a ham, like that's going to be the main mnemonic over here for secondary osteoporosis. So I hope you guys enjoy this. Hopefully you find this useful. Thank you for watching, and I hope to see you guys next time.